Today we're going to be demonstrating how gentle, safe, and effective it is to adjust a newborn baby with chiropractic care. Okay, so today we're here with baby Oakley. Oakley is 6 days old today, and he is in for his very first chiropractic adjustment. Oakley's not having any symptoms or any problems yet, and what we're doing is just giving him his first wellness checkup to make sure everything in his whole body is functioning properly to help himself and also help his mom. It's okay, so what I'm going to be doing here is just running my fingers up the back of his spine, and we're just checking for little restrictions anywhere in his pelvis and in his spine. Good. And what we do when we find one of those, for instance, in little Oakley, we've got a little bit in his very right side of his lower back here. And what I'm going to do is just hold some very steady, gentle pressure, about the amount you'd hold when you're checking the ripeness of a tomato. And we're going to wait for that to release. Very common when we do this for them to get a little fussy and then relax as soon as it releases. They might also let out a little bit of gas sometimes. And hiccups are also very normal. But most of the time, this will feel very good for baby, so it'll often help him fall right to sleep when we finish. There's a big yawn. When I'm checking this, I'm also going to do a little poking around his belly here. And what we want to make sure is that there's no tissue restrictions anywhere around his stomach, which in little guys like Oakley can sometimes lead to things like acid reflux, constipation, and sometimes just an all-over upset belly. And we're just going to take a peek at his neck here. And again, you might get a tiny bit fussy, but then he should calm right down. Yeah. There you go. Good job. All right. Some very common conditions that we'll treat with newborns and babies are things like colic or acid reflux, constipation, sometimes ear infections, poor sleep habits if they're just all over fussy. The reason it's important to get them checked out by a chiropractor is because things like the labor and birth process, or sometimes the position that they're in the mama's belly for that long period of time, can sometimes alter some things in their nervous system and in their structure. So what we're doing is we're just making sure that their structure is as functional as it can possibly be so that their nervous system is working to the utmost of its ability. Isn't that right, Oakley? If you like this video, please share with your friends and subscribe to our channel.